Good evening, everyone. I thank the organizers for giving me the opportunity to talk about trends in neonatal care. Neonatal care has undergone significant advancements in recent years, driven by innovations in medical technology, a deeper understanding of neonatal physiology, and improved health practices. In this presentation, I would like to highlight on few trends which have taken place in neonatal care. The first and foremost is the personalized care. We know every single newborn is unique from a different background, either in terms of socio-economic background or educational background of the parents. And so we need to personalize the care so that it will be so applicable, and also they'll be able to adapt to the teaching that we give. So personalized care is a current trend. And also family-centered care. We must make sure that the family members are involved in the care, particularly the father and the mother. In India, we do have, in some families, there are other family members like the in-laws. But by and large, even in India, nuclear family is a kind of trend, and therefore at least the father and the mother should be involved in care. Decision-making must be made only in their presence, and consulting with them, we can give them the alternatives to decide on, and they must be involved in decision-making as well in care of the newborn. And this has become pronounced, emphasizing the involvement of parents in the care process and recognizing the importance of early parent-infant bond. Nutritional strategies have also evolved with an increasing emphasis on human milk feeding, including the use of donor milk and fortified breast milk to support the optimal growth and development. Additionally, the role of artificial intelligence and machine learning in neonatal monitoring is expanding, offering the potential to predict and prevent complications by analyzing the real-time data from monitoring system. We know these newborns can head into various complications very quickly, unlike the older kids or adults, like hypoxia or hypoglycemia, hypothermia, any metabolic problems like electrolyte imbalances and so on. So AI is really playing a greater role in identifying the complications, the signs and symptoms in the much early stage, so that it can be intervened and can be rectified at an earlier stage. Integration of telemedicine is also improving access to specialized neonatal care, particularly in remote or underserved areas. Country like India, where we have majority of them, 70 to 75% of them are from rural setup, and especially in our institution where they come from different states, and so tele-consultations and education through tele-conferencing, it's quite useful so that their cost is contained. And as the survival rates of preterm and critically ill newborns continue to improve, the focus is shifted towards long-term neurodevelopmental outcomes, leading to a greater emphasis on developmental care and early intervention programs. These trends reflect a paradigm shift towards more holistic, individualized, and technology-driven neonatal care, ultimately enhancing the quality of life for the most vulnerable newborns, like the high-risk newborns, low birth weight, or babies who are large for date and also small for date newborns. Advances in monitoring technology, non-invasive monitoring techniques have transformed neonatal care. Devices like NIRS, the high-frequency ultrasound, near-infrared spectroscopy, and wearable sensors now enable continuous real-time monitoring of vital signs and brain activity without disturbing the infant. These technologies offer more accurate, less invasive assessments of health, leading to better management of premature or critically ill infants when there isn't a need for poking them very often. And also advancements in neonatal intensive care technology, non-invasive monitoring in the NICU setup, especially for monitoring the oxygen like EPA, carbon dioxide monitors, and also other transcutaneous oxygen monitors, infrared spectroscopy, cardiovascular monitoring. All these also are quite useful. They prevent the invasive procedures like blood draws and arterial line insertions, and therefore these are gaining their importance in the present day scenario. Non-invasive respiratory support, especially the high frequency the nasal high flow therapy. Actually, they have replaced the invasive ventilation. Even cost-wise, it's quite cost effective, and they get discharged also very faster compared to the invasive ventilation, where they need to stay on at least for 7 to 8 days in the neonatal care unit. And particularly in treating children with the RDS, this is gaining its importance. High frequency oscillatory ventilation, recent studies suggest that the use of HFOB as a ventilator strategy in premature infants with severe respiratory distress syndrome may improve survival and reduce long-term pulmonary damage, though the debate continues in specific settings. As deliberated earlier, personalized care and family-centered care are important. They are gaining their importance, especially we promote the gangrel care, the skin-to-skin contact care among the newborns. Developmental care. In NICU, environments are being modified to support the developmental needs of neonates. This includes they are quite noise sensitive and therefore light sensitive. So reducing the noise, improving the lighting, and creating a sensory friendly spaces. We also make sure that the spacing is adequate between the cots, the neonatal cots or the incubators, and we make it light sensitive, and also we reduce noise levels, and various measures are taken to reduce the noise levels in the NICU. Research has shown that these adjustments can support neurodevelopment and reduce the incidence of cognitive delays in infants who spend extended periods in the NICU setting. Nutritional advances. Optimal nutrition is critical for the growth and development of neonates, especially the preterm infants. There is an increasing emphasis on human milk feeding with a growing recognition of benefits of donor human milk and fortified breast milk for preterm infants. Nutritional strategies now aim to prevent NEC, the necrotizing enterocolitis, and support brain development using tailored feeding regimens to meet the unique neonatal needs in the NICU setting. Human milk and breastfeeding advocacy. There is an increasing recognition of importance of human milk, particularly for preterm infants. Studies consistently show that breastfeeding or providing human milk, either directly or via expressed milk, significantly reduce the risk of infections, particularly NEC and other morbidities in preterm neonates. Hospitals are now prioritizing human milk banks and donor milk as a resource for infants who cannot receive their own mother's milk. Fortification of human milk. Research has also explored the role of human milk fortifiers to meet the higher nutritional demands of preterm infants. Studies have found that the proper use of fortifiers can improve growth and development in preterm infants, although the specific types and timing of fortification continue to be areas of active investigation. AI and machine learning. This is being integrated in neonatal care for predictive analysis, especially to identify the signs and symptoms of complication in the much early run, so that intervention can be carried on at a much early stage. So there will not, especially in terms of respiratory distress, where brain injury cannot occur. Early intervention based on AI-driven insights can improve outcomes and reduce the need for invasive procedures as well. AI has begun playing a critical role in predicting neonatal outcomes by analyzing large data sets of patient information. A 2023 study showed that AI models could predict the risk of sepsis and other infections in preterm infants with high accuracy, potentially leading to early interventions. Telemedicine and remote monitoring, which had already deliberated, it's particularly useful in providing expert advice when the on-site specialists may not be available, particularly in a country like India, where the proportion of the medical personnel compared to the general population, which is quite low, and therefore this is very, very useful. Focus on neurodevelopmental outcomes, where early interventions such as physical, occupational, and speech therapy, neonatal care, where there is a collaboration, there is a neonatal therapist, intensivist, there is a neonatal nurse, also physical therapist, occupational therapist, and speech therapist. All of them put their efforts to get social worker, all of them put their efforts together so that the developmental care of the child and the practices in NICU will be well fostered, and the standards also will be well maintained, so that they do not land up with the problems like neonatal developmental delays and long-term complications can be prevented with intervention, neurodevelopmental interventions. Development of new medications and therapies, the development of new pharmacological therapies for neonatal conditions such as RDS and patent ductus arteriosus has expanded treatment options. For example, the use of surfactant therapy for premature infants and prostaglandin inhibitors for PDA has significantly improved survival and outcomes. Ongoing research is focused on improving the efficacy and safety of medications for neonates whose small size and immature organs require special considerations. Advances in genetic screening and personalized medicine, neonatal genetic screening has become increasingly sophisticated with expanded panels for detecting metabolic disorders, genetic syndromes, and other conditions that may not be apparent at birth but could significantly affect the long-term health. Genomic medicine is also playing a growing role in tailoring treatments to individual neonates, particularly those with rare genetic disorders. Precision medicine and genetic testing, whole genome sequencing, the WGS, is now being increasingly applied in neonatal care to identify genetic disorders early in life. Studies show that genomic testing can detect rare genetic conditions that might otherwise go unnoticed, leading to tailored treatments and better outcomes for affected newborns. Pharmacogenomics also is the other trend. Understanding how a neonate's genetic makeup influences their response to drugs is a growing trend. Research has shown that pharmacogenomic testing can help in determining the right medication dosages for newborns, minimizing adverse drug reactions and improving drug efficacy. Neonatal sepsis and infection control. Neonatal sepsis, children particularly in the neonatal area, NICU, can develop, because of their stay in NICU, can develop ventilator-associated pneumonias or CORTI, or they can develop UTI and surgical site infections, particularly if they've undergone surgeries. So early detection treatment of neonatal sepsis remains also one of the leading causes of neonatal deaths, and therefore we need to take extra caution. So recent studies are focusing on early biomarkers study like procalcitonin or C-reactive proteins for rapid detection of neonatal sepsis. Early initiation of antibiotics and other targeted therapies is critical. It is very critical to reduce mortality. In some of the newborns, they are treated outside, maybe in smaller clinics, and when they come, they are already resistant to some of the antibiotics, and therefore the intensivists, they are forced to start them on third-line antibiotics. But otherwise, generally, all cautions are taken to minimize or prevent antimicrobial abuse. Antimicrobial stewardship, the rise of antimicrobial resistance has led to greater focus on appropriate use of antibiotics in neonates. Researchers show that unnecessary or excessive use of antibiotics in NICU can lead to multi-drug resistant infections. Ongoing studies are examining the optimal antibiotic regimen, duration of therapy, and alternative approaches to managing neonatal infections. In conclusion, neonatal care is undergoing rapid evolution driven by innovations in technology, a shift toward more personalized and family-centered care, and increasing focus on improving long-term outcomes. The integration of advanced monitoring, non-invasive techniques, AI, and enhanced nutritional strategies is reshaping the standard of care for neonates. These trends are not only improving the survival rates, but they're also ensuring that the infants receive the best possible foundation for healthy development. Newborns are quite important to be cared for. They are so important for the family, for the society, for the nation at large. And they are mini angels, and therefore we must take all caution in providing the best care possible, safe care, and also quality care. And therefore it is the need, or it is the responsibility of the pediatric nurses and neonatal nurses to cater to these newborns with extraordinary care. Thank you for the opportunity, and God bless our team. Thank you.